Melanoma is a type of skin cancer. When we think about skin cancers, we put them into two general buckets, the non-melanomas and the melanomas. The non-melanomas are the ones like basal cell and squamous cell. Those are by far and away more common. But the good thing is they're less likely to spread to other parts of the body and therefore are less deadly. The problem with non-melanoma skin cancers is that they just grow and grow and grow. They bleed, they don't heal, and they can invade that local tissue wherever they are, and they can cause disfigurement, disformity. So they are a problem, and we still take them very seriously. Melanoma, on the other hand, is less common but more deadly. Melanoma can metastasize, meaning it can spread to other parts of the body, and it can affect someone's lifespan, meaning it can kill them. Melanoma comes from the pigment-producing cells in the skin, and those are called the melanocytes. So that's why it's called melanoma. The main causes for melanoma are UV radiation, so meaning like sun exposure, tanning beds, and then genetics. And about 10% of people who get melanoma have a family history of melanoma. And that can be due to underlying genetic mutations that are carried in the family lineage, and those can be associated with other syndromes, or it can be just due to shared characteristics within the family members. And we'll talk about that a little bit in a second. So anyone can develop melanoma, but there are certain risk factors that make an individual more susceptible to getting it. And for those, we think about fair skin, people who have lighter hair color like blonde or red, lighter colored eyes like blue or green, people who are prone to freckling, sunburns. All of those people have less natural pigment in their skin to protect them from UV damage. The other bucket that we think about is genetic factors. Some families have underlying genetic mutations that make them more susceptible to getting melanoma or other cancers as well as melanoma, and those can be inherited as cancer syndromes. And the other bucket that I would really think about is people who are on immune suppression, particularly transplant patients. They're on long-term chronic immune suppression, and what that does is it blocks your body's natural defense mechanism to surveillancing, finding these cancers and shutting them down. And so basically the cancers can go unchecked. And so melanomas are a part of that and can be a higher risk of developing those. So melanoma can essentially come up anywhere. The most common locations that we think about are on the trunk, particularly the back for males, and the lower extremities, the lower legs for females are the most common location. And then also the arms, the head and neck, those areas where you're getting chronic sun exposure. Typically in elderly people we see these, and we call those lentigo malignas. And then there's other more rare sites, so ocular melanoma in the eye. There's mucosal melanomas where you can get them in the oral mucosa, the mouth, the vaginal mucosa. And then there's another subtype called acrolentiginous melanoma, and those tend to come up on the palms and soles and also under the nails. The acrolentiginous form of melanoma is more common in people who have pigmented skin, particularly African Americans, but also Hispanics and Asians. So the classic teaching is the ABCDEs to search for and detect melanomas. A is for asymmetry, so if it's not symmetric on both sides, you can think of normal moles have that nice kind of oval shape, so if they're uneven. B is for borders, irregular borders, jagged edges. C is for color. If there's multiple different shades of brown, black, tints of blue, white, pink, or even if just one of the moles looks different than all the other moles, if it's a different color, that can be a tip-off to melanoma. D is for diameter, greater than an eraser tip. Basically, you're looking for larger lesions unless they're caught earlier. And then one of the most important ones for patients is E, evolution, and that means change. You know, a lot of times it's hard to know, well, is this normal, is this not normal? But what a person can do is have a good sense of what their skin looks like, know what their moles look like, know what's there, have a partner take pictures of the back back, or regularly look at the back in areas that are hard to see, and keep an eye on things. And if you notice a new spot come up or an area that's changing, sometimes that can be a tip off to a potential melanoma. I will say that not everything that meets these criteria is actually a melanoma. There are abnormal moles that can look like this. There are even benign growths that can look like some of these characteristics. And not all melanomas fit that criteria either. There are such things called amelanotic melanomas, amelanotic meaning without pigment, and those can be really difficult to diagnose, and they can just look like a pink area, and often we'll need a dermatologist to help sort that out. Whenever we think about any type of prevention of a cancer or a disease, we think about modifiable risk factors, and that means characteristics or behaviors that can be changed to affect the outcome. Obviously, we cannot change our genetics right now, at least. We can't change what our family gave us. We can't change, the features of our skin and our hair and our underlying cells. But what we can change is our UV exposure, and we know that UV light is very strongly associated with causing skin cancers, and that's why dermatologists go so crazy about preaching sun protection, because we know that this is a very simple intervention that we can do to actually fight skin cancer. And so that the way that we do this is, first of all, avoid tanning beds. Second of all, avoid going outside during the peak hours of the daylight. That's around 10 a.m. to about 2 to 4 p.m. If you are going out during that time, you want to try and seek shade, wear sun protective clothing, and use sunscreen. The sunscreen recommendations are you want to have broad spectrum UVA, UVB coverage, at least a minimum of SPF 30. You want to apply it about 15 minutes before you go outside, and then reapply it at least every 2 hours, but potentially even more often than that, particularly if you are sweating or swimming. I find it very difficult to keep up with the amount of sun protection you need when you're outside for long periods of time with just sunscreen. So my preferred route is to use sun protective clothing. And by that, we mean UPF clothing. It's special clothing that is knit in a way that it blocks the UV light from getting into the skin, and it serves as a form of sun protection. And that's my go-to for when I'm spending long periods of time outside, anything more than really half an hour or an hour. And you want to look for hats, broad-brimmed hats so that it can cover the ears, sunglasses. You can get skin cancers around the eyes, damage to the eyes from UV light. So sunglasses are also very important. And don't forget to put the sun protection on your lips as well, because you can get skin cancers on the lips. So all of those things can be really important in preventing melanoma and other skin cancers.